Today is inclusion of gender diversity and gender equality efforts. And we're focusing on CRVS ID and legal identity. We are representing the Data for Health initiative, which works in 25 low and middle income countries around the world. And also very much with our partners, UNSCAP. And we're also representing Johns Hopkins University, Bloomberg School of Public Health, Global Health Advocacy Incubator, and the State Rainbow Society Foundation, right? In Rajasthan, India. So just a little quick ground rules. I think this is probably just, I feel like we're in the center of diplomacy here at the UN, but to just, agree to disagree and use people's preferred pronouns or the person's name, and to stay on topic and avoid personal attacks. Sorry about that. And then I will just, I'm just going to move through these rather than talking about it, but just to really be clear about that there's a difference between sex and gender and sexual orientation. And sex is the label assigned at birth based on biology, and gender is a social construct and not limited to the binary. And for sexual orientation, it's around your physical, romantic, or emotional attraction to members of same, different, or any gender. So, and now it's really my pleasure, because that was just a little bit of housekeeping, but it is my pleasure to introduce Noor Shekhawat, who is a president and founder of the State Rainbow LGBTQA Society. Thank you. It's my pleasure to introduce Noor Shekhawat, who is the president and founder of the State Rainbow LGBTQA Society in Rajasthan, India. And please come, Noor. We would love to hear your story. Thank you.
Namaste, everyone. I hope you all are doing well. My name is Noor Shekhawat, and I identify myself as a trans woman. My pronoun says she and her. I'm running an NGO organization, a community-based organization in Rajasthan, India. My organization works on the gender issues faced by the diverse gender. And I'm also like to say that I'm proud to having a first person in India to having a birth certificate. However, I want to emphasize that I'm the first one, but I don't want to be the last one. Now, you may ask me why it is important to having an updated birth certificate for a transgender. So the place where I come from, Rajasthan, the government, actually, it is very important to have a government issued gender accurate identity document to get access to social benefit schemes like scholarship, pensions, housing schemes, and the hospitals like care schemes as well. So yes, we can say it is play an important role for the transgender community to having a update birth certificate. I can give you an example. Before I updated my birth certificate, I tried to attend a girls' college because I am a woman. But girls' college kept referring me to boys' college because of my identification document said male, despite my gender identity and expression. I worked with the Global Health Advocacy Incubator and who is with us today, as well as Indian government officials, to update my birth registration and to get a new birth certificate. At the end of the process, I was able to having my passport update. So this is my first international trip after having that changed birth certificate. My greatest achievement in life was to get my gender appropriate birth certificate. It was like a new birth for me, because after that I can pursue my further studies and having a good career options in my life. Now I'm studying in a girls government college named as Maharani College in Rajasthan, India. My aim is to become a politician, to get to work for my community in a better manner. I want to bring about changes in the lives of my community and the youth icon for Election Commission of India, to encourage people in India for the voting and to represent the rights and needs of the LGBTQI community. And I'm the first person in the state having a community-based organization. As I'm working with Guy for my birth certificate, my organization also working with Guy for the other transgender to help them out for their updated birth certificate. We are working in Rajasthan, and soonly we going to rolling it out in other countries and states as well. My advocacy is focused on making social inclusion of diverse gender more accessible, and I'm sure I would succeed in it as I encourage people to be proud of their true identity, whatever they are. Thank you. Namaste.
Really the civil registration and vital statistics process and why this is so important that Noor was able to change her identity on her birth certificate.
Thanks, Deb. Hi, everyone. My name is Madeline, and I serve as the Associate Director of Gender Advocacy at the Global Health Advocacy Incubator, or GHAI, or GUI. GHAI supports civil society organizations and organizations in more than 40 countries to pass public health policies that save lives, reduce disease, and prevent injuries. We're working to advance CRVS ID systems that are accessible, equitable, and inclusive to provide governments with population data and vital statistics that are essential for evidence-based policymaking. In terms of being more concrete about what we're talking about when we say gender inclusion in CRVS ID, today we're talking about gender diverse people such as non-binary and transgender people having access to civil registration services, or more specifically, birth registration, and therefore the ability to update identity documentation, starting with birth certificates. In other words, we're talking about the facilitation of legal gender recognition, the process of amending documentation, including birth registration, to align with a person's gender identity. From the outset, I note that not all trans people wish to obtain legal gender recognition, and some prefer a system in which sex and/or gender markers are not included on ID. However, for many people, having a legal sex or gender which matches their gender identity carries great importance. And sex and gender-specific data gathered through civil registration also is very important for governments, which I'll return to. In terms of why we need it, as Noor has illustrated, access to civil and identity documentation and registration is critically important because these systems provide for legal identity documentation, which is vital for the exercise of human rights and to benefit from and access services. For example, the sex marker on a trans person's birth certificate or identity card typically reflects sex assigned at birth, as distinct from gender identity, which can have a range of negative ramifications. Without gender-aligned documentation, transgender and non-binary people may experience barriers to education, as Noor illustrated, but they can also experience the partial or full restriction of the enjoyment of other basic human rights, such as access to health, to social welfare, and to marriage. This can also impede access to services like financial systems. In situations in which identification is required, outdated sex and gender markers can also expose people to harassment and/or violence. And identity documentation that accurately reflects gender can be crucial for mental health and well-being. In terms of government considerations, in adopting efficient processes for gender marker change aligned with principles such as those set out in the Yoga Carta Principles +10, so the additional principles and state obligations with respect to the application of international human rights on sexual orientation, gender identity, and gender expression, countries can align themselves with international best practices and human rights standards and advance equality and inclusivity. They can also make progress towards the Sustainable Development Goals, as a 2019 UNDP and Asia Pacific Transgender Network multi-country legal and policy report on legal gender recognition noted. Legal gender recognition is, quote, a crucial step for achieving a number of Sustainable Development Goals, including gender equality and ensuring healthy lives. Additionally, reducing the hurdles gender diverse communities face in amending civil registration records can help ensure that countries have access to accurate and timely vital statistics and population data. This allows governments to better understand and respond to health inequalities in specific population groups and changes in mortality patterns. These are among the incentives for governments to work towards stronger access to legal gender recognition through civil registration. And we see this in our work at GHAI. We are developing a global status report on civil registration practices that provide for legal gender recognition. And our research is informed by our work in countries. These include in Rajasthan, India, through which in Project 1000, we work to strengthen state government responses and systems providing for transgender birth certification. And my colleague will speak to this momentarily. We're also working in Colombia with a CSO called La Liga de Salud Trans on a project that works to implement a landmark constitutional court decision on non-binary people's inclusion in civil registration. We often describe this work as aimed at ensuring that people both, quote, count and are counted. And in my view, this is related to the central promise of the SDGs, namely to leave no one behind. Thanks.
We're going to be a little interactive. So I'd ask you to take out your phones. And I'm going to put up some slides and you'll see what to do in just a moment. But if you could take out your phones and go to MENTI.com. Okay. And at the same time, what we'd really love for you to do is take out your ID card that you use to get into the building. And so what we're going to do is have you look at your ID card and see if it has a sex or gender marker on it. And you go to menti.com and you put in the code 89309129. And whoops, I'm sorry, that was too dark. Yeah. Okay, looks like we're able to get there. Okay. Okay. Kind of fun, huh? You'll watch as you're all clicking. Okay. And then the next question is, do you know, and it should come up just while you're on menti.com, do you know anyone who has a marker on their ID that isn't male, female? And this is all anonymous, so don't worry. You can see it's just aggregate data. And people on Zoom, please, you're welcome to join by going to menti.com and using the code 89309129. Okay, so good. So some people know people who have a marker on their ID that isn't male, female, but most people don't. Okay, fantastic. Okay, and now I will pass the mic over to my colleague, Kate Wright, who's going to speak about a key informant study that we did at Johns Hopkins.
Hi, everyone. Can you hear me okay? Okay. I am Kate Wright. I am the research lead at the Gender Equity Unit at the Johns Hopkins Bloomberg School of Public Health. Thanks for joining today. I just want to take a few minutes to describe the results of a study that we conducted in 2023, during which we interviewed 30 key informants in 21 countries that included South America, Africa, Asia, and the Pacific. And we were hoping to better understand the current context of gender integration into health data collection, analysis, and use. And within this study, we did include questions specifically related to CRVS documents, like birth and death certificates. So across Asia and the Pacific, we interviewed 13 key informants in these 9 countries here. Key informants included leadership from the Ministry of Health, the Ministry of Public Health, academics, other researchers. We had some medical doctors and program specialists within the UN. And all key informants were involved in the decision-making process around health data collection, analysis, and/or use. So one of the findings from this study is that according to our key informants, out of these 9 countries, 3 included the option to change your gender marker on your birth certificate. Oops, I forgot I was in charge. And each of these countries approaches this a little differently. So you can see here, Bangladesh includes female, male, and third gender on both birth and death certificates. India includes female, male, and transgender on birth and death certificates. And Sri Lanka includes female and male. And the decision to only include female and male in Sri Lanka was based on feedback from within the community, where there was a bit of concern that there might be some discrimination if there was a third gender listed on the documents. So there are different approaches in each of these countries, and whatever is recorded on the birth certificate is recorded on the death certificate as well. Another important finding from this study was that many key informants described a lack of understanding of the term gender itself. Excuse me, and therefore it's difficult to make these kinds of changes where you're adding a third gender to CRVS documents. So we're excited today to discuss barriers and potential facilitators to making these kinds of changes within your context. So this is just a little feedback from these specific countries. And then next we will hear from who is sitting here, and he's going to discuss some specific country experiences.
Yeah, thank you so much. And I'm Bera, a regional advisor Asia Pacific for Global Health Advocacy Incubator. So this is our first project. So we call it as Project 1000, and which actually is a snowball experiment, and which takes into account the reissuance of birth certificates of trans individuals. And as we see that Project 1000 is a joint collaboration of Global Health Advocacy Incubator along with Government of Rajasthan and State Rainbow Foundation, along with other civil society organizations in that state. And in this specific project, the first, I would say, the first moment was when Noor got the first birth certificate in India. And when we say that like it's a first birth certificate, it actually raises alarm, how it is the first one at the age of 30 years. So, and that's where the concept of like the sex and gender comes in. So Noor was born, Noor was assigned male as in the birth certificate, the first birth certificate. But after some time at the age of 13, she realized that the gender is like a bit like she does not want to be with the initial one. And then she actually approached multiple authorities for changes in her certifications. And recently, like Government of India in 2023, there was an amendment of the Registration of Birth and Death Act, which made birth certificate as the central piece of paper to all services. And that's where this movement began. Earlier, it was not so complex because the new RBD Act has the revised amendments of birth certificate as a central thing. So everybody needs to have their birth certificate right, so that all the documents leading from birth certificate, be it a passport, be it a driving license, be it like the social welfare scheme, be it the unique identity number that we call it as like Aadhaar card, and in Rajasthan, specific welfare schemes related to Jan Aadhaar schemes. So everything has to be connected. And to that, we started the project. And we focused on only one thing, the birth certificate. And this was in I think like on July 23, the first certificate was issued after a lot of a lot of discussions. We sorted out the apprehensions from the government authorities because always the first is the most difficult one. In fact, we had like multiple legal rounds of discussions around. It took quite a while. At the same time, Noor had been like advocating, had been like sorting out her baseline papers so that this birth certificate can be issued. And one of the like major motivation was like her higher studies. She wanted to get admitted in a girls' college and continue her like BA political science. But it was not happening because the birth certificate was not in line, and even the passport was not in, means she didn't have a passport anytime. So this specific entry point was, as GHI is an organization which support development of legal frameworks as well as revision of developments, legal frameworks. So the legal framework is already been provided by Government of India. We call it as like the famous NALSA judgment, National Legal Services Authority judgment of 2014, followed by an amendment of 2019, which specifies that uh, any person can have a voluntary declaration for a change, and that facilitates the creation of the first card, which is called as a transgender card, transgender ID card. And from that transgender ID card, multiple legal and procedural things have to be maneuvered to get in the birth certificate, and it's a bit of complex. It takes usually a lot of time, but at the same time, government's initiatives, as everybody is new to this entire concept, so everybody is learning from each other. And with this, the birth certificate actually led to the following changes, and Noor got admitted as a, means she entered into the Rajasthan University as the first transgender student. Again, like I would like to highlight this specific document, which is India's like UID. And as you see, like the first, means the previous one had mentioned as male, now it is transgender. Now the Jan Aadhaar scheme, which is the social welfare scheme, so that for that also we need to have an ID. That ID also has been like changed, and so these are the services that actually is linked to a birth certificate. And because the RBD Act 2023 mandates it, so nobody can escape this legal maneuvering. Also, the Election Commission of India has
Namaskar. मेरा नाम नूर शेखा.
So the Election Commission of India actually has nominated Noor as the trans youth icon, and because we do have like around, our expectation is around 5 million trans the community members. So she actually advocated, and like the Government of India requested her to be the icon and appeal, and this is the appeal that was released by Election Commission of India in the recent Lok Sabha polls, which is the biggest poll. So can we play this video? Yeah, this is 30 seconds.
नमस्कार, मेरा नाम नूर शेखावत है. मैं राजस्थान जयपुर से हूं और मैं एक ट्रांसजेंडर हूं. राजस्थान में मतदाता सूचियों का विशेष कार्यक्रम 21 अगस्त 2023 से प्रारंभ हो रहा है. यदि आपकी उम्र 1 अक्टूबर 2023 को 18 साल की हो रही है या हो चुकी है, तो आज ही मतदाता हेल्पलाइन ऐप के माध्यम से मतदाता हेतु पंजीकरण करें. लोकतंत्र में प्रत्येक मत महत्वपूर्ण है. सशक्त लोकतंत्र में अपनी भूमिका जरूर निभाएं.
Thank you. And so with Noor's appeal, it went through the entire community, and now like as GHI started with one state, but we have moved into multiple other states. We recently concluded a session at the UN Data Forum in Medellin, and the entire focus was like on expansion, as well as like how do we measure it, because the first step is like creation of a project, but the next step becomes the framework, because on a project management style, it has to be like captured somewhere. And as I described before, the birth certificate has actually led to a legal identity that conforms to the gender. The birth certificate is aligned to the right of education, which is the Right of Education Act of Government of India. All the government welfare schemes that actually apply to transgender individual that have been like applied, right to vote as a trans individual, as well as like the youth icon. And we celebrate this moment because Noor has been like I would say the pivot point and actually the ambassador for the rights that were previously like we never thought of, like we could maneuver and we can get something which is captured. And so we promote a framework, a M&D framework, which are based on 4 principles. And the first principle is the legal and procedural framework. As GHI is a policy action organization, we believe that legal frameworks should be right in place, so that only like the proper civil registration things will go in line. Also, the frameworks speak a lot about like lived experiences, and that's why we promote the community members as a center. And we also facilitate multiple discussions, deliberations in which Government of India officials as well as like community members come hand in hand along with the civil society organizations, so that all the problems can be sorted out. Might be at some point of time we do experience that some of the officials who are in charge of like register, who is charge of like issuing of the certificate, they have some confusions and apprehensions, but this type of forums actually help to like clear that out. At the same time, they get in the confidence from the community that like there will be full support and the work goes in like smoothly. The entire like premise of like this type of projects builds on like strong partnerships, and all our projects are well supported by Government of India's as well as like the state governments. And the last is like we promote human right based approaches, and these are all the guiding principle of our project 1000. And the project 1000 it promotes sustainability, as we promise only to facilitate release of 1000 certificates, but that is going to be a national movement. Like the first birth certificate has actually helped in like moving out the entire nation. Like it has given a fresh impetus, a fresh energy. And like this project, like it will end in like 1 or 2 years, but the movement goes on. So we hope like in another 5 years we'll be issuing like more than 1 million birth certificates of reissuing 1 million birth certificates of the transgender community members, and that improves their lives as well as like a big like a win for civil registration. Thank you so much.
Go back to menti.com. Give me one moment, and because we have some more questions. So this one is, do you know of any advocacy efforts in your country to add options for additional sex and or gender ID markers? So things like campaigns, legislation, media. We're at 50-50. Just a yes or no question. Anything in particular that you know is going on in your country? You just want to hold on to that for a moment. Okay, so where it looks like now we have quite a bit of advocacy going on. Okay. Okay, and now we are going to, the next question is, we are going to ask you to type. So, what factors do you think could be leveraged to improve gender recognition of transgender, non-binary, and intersex people via CRVS ID. You just go to menti.com and use the code. You're welcome to put in as many answers as you like. And then for the panelists, Noor, is there anything that that you see that strikes you as something interesting that you want to speak to?
Media plays an important role to spread awareness.
Yeah, absolutely. And we saw with Om's presentation about how the media really picked up on this, both regionally in Rajasthan and also the whole country. It was pretty amazing. I also would add, I think whoever wrote personal stories, I think personal stories are quite meaningful. So thank you again for sharing yours. Okay. Okay, so interesting. So in the bottom left, we've got legal review of CRVS laws. So is that something that I think we could speak to a little bit more, because GHAI does some amazing work around legal reviews that includes particular chapters around LGBTQI folks, as well as women and girls, as well as stillbirths.
Yeah, thank you. And the last slide of mine mentioned about like strong legal and procedural frameworks, and this actually is the pivot stone. And as I mentioned, in 2014, Government of India had this famous judgment called as like Nalsa judgment, and that actually opened out avenues, but this was unexplored. And GHI, as like it's a mainly a policy advocacy organization, we always believe that like legal frameworks are the first step, and within legal provisions, we always feel, or all country members should feel that like they need to review the existing legal frameworks. If like the study that has been presented by Kate that mentioned like India having three fields, male, female, and trans. But at the same time, Sri Lanka, which is close neighbor of like India, they do not have. They only have a male and female. At the same time, we do have a qualitative part which mentions that the community didn't want to have the third gender recognized. So if at all Sri Lanka wants to move forward with registration of like a civil registration, which is one of the means in lines with the best practices of the world, then the first step would be a legal review, which already has been done to some extent captured, followed by amendments in the existing law, or they need to put out like a judgment, followed by state rules, followed by frameworks of how do we capture it. So for any policymaker, these are the steps that needs to be taken care, and then only successful, sustainable CRVS ID systems can be possible at this moment. Else, the efforts like always like move in one direction of like advocacy. We need a strong CRVS ID systems, but at the same time, at the back end, there is no support mechanism to capture those. And we have seen in multiple countries that the demand is high, but the framework does not support the capturing or the revisiting of the or reissuances of the birth certificates. In India also, we have seen the same. In some of the states, the software is not upgraded in a way to capture the third gender. This might be a miss of the mind because the law is there, but at the same time, there has been like the necessary modifications has been not been done at the IT level, which might be the top end officer does not like have like thought of. So legal and procedural frameworks need to be cleared first, and then only the entire essence of like an activism followed by demand generation and the community demanding about like the certificates that makes the impact. Else it needs to be balanced from both the demand side as well as the supply side. Yeah, thank you so much. Yeah.
I just, there's a wonderful little feature here, and it sorted our answers into national policies, public awareness, media engagement, legal review, and CSO engagement. And so we've talked a little bit about, and we'll categorize the new ones that are coming in. But we talked a little bit about media, we've talked about legal review. What do we want to say about national policies?
Yes, so national policies are again linked out to this reviews because policymakers think a bit are like more heavy towards the legal side. They always want to have a policy which is like well weighed on by the topmost like legal consultants or the legal faculties. And in from the country perspective, wherever there's a judgment from the legal courts, that become the foundation pillar for a successful policy, be it India, be it like Colombia. Like in a example I would provide is in India in 2014, the legal judgment came in 2019, successive legal judgment. And then the amendments in the law were like more impactful because it was backed up by Supreme Court of India's like judgment, which are strong enough. Versus Colombia, where a legal judgment is already there. Now the thing has to happen in the parliament and then an act. So without referring to a legal judgment, it becomes very difficult for policymakers to renew or like to amend an existing act. And so these are some of the experiences from CRVS. But if we go across other verticals in health also, we have seen legal judgments are an easy way to, first the legal judgments followed by policy amendment. It makes easier life, means it makes life easy for everybody. Yeah, I hope.
Fantastic. I was just noticing somebody posted when other countries in the region adopt new best practice frameworks, and I think it's wonderful how India's been a leader, and I know Sri Lanka is also trying to do some work in this field. Kate, are you comfortable speaking to that? Are you familiar? No?
Specifically in terms of not specifically in terms of their frameworks in Sri Lanka, because that was not part of the interviews. So, but maybe someone else who's here could contribute.
Any other countries that people know? Any other countries that people know about that might be, learning from the experiences in India, in the UNESCAP region, please.
Nepal. I'm from Nepal. I made some progress. It's a Supreme Court decision.
Yeah, that's okay. We're trying to include the folks on Zoom. We do have a Zoom audience as well. Thank you.
Sorry about that.
Thanks, Tanya.
So I could talk about Nepal. I'm from Nepal and I work on this issue. It's sort of related to citizenship and nationality rights. And in terms of in the rights of non-binary and other genders, we have a separate gender marker or sex marker called other gender or O, which has been amazing, but also is slightly problematic because it conflates sex, gender, and sexuality, and includes transgenders, includes lesbians and gays, and sort of it's really sort of problematic in that sense. But it still has been an achievement. And there's a recent Supreme Court decision to sort of legalize or sort of to allow marriage equality as well, which is pretty recent, hasn't been implemented. So yeah, there's been those kind of progress, but there are still so many other issues. I don't want to take more time to discuss it, but there's been some progress in that sense.
Okay, I said thank you so much. Anyone else know of advocacy or some movements or work being done in other countries within the UN SCAP region? And or any other questions or anything that you see up here that you'd like to discuss? Otherwise, I'll keep picking and choosing happily. I would say I am curious about speaking to the inclusive religious and cultural interpretations. Please. Thank you so much. Thank you, Om. Is it on?
Okay, yes. Okay. Thank you. I am Raka from ASEAN Youth Forum. I currently live in Indonesia. In Indonesia, especially in terms of like recognitions of the transgender, non-binary, and intersex people, is stuck in the matter of the religious and cultural interpretations of gender. So when the advocates try to add the gender recognition through the law, our progress always has been held. So we are currently in stagnant positions due to the religious and cultural interpretation that the religions in Indonesia, the culture in Indonesia reject that the diversity of the gender in Indonesia. So alternatively, there are many religious organization that is starting to work on religious interpretation to flip the narratives that the religious and also the cultural of Indonesia rejects diverse gender identity. Yeah, some of them are from the Muslim communities. There are trans women Islamic boarding school in Yogyakarta. Also, there is a coma, and also in the Archdiocese of Jakarta, the Catholics, they are also starting working on it. In the Christian, there are many denominations working on it too, especially like in the Huria Kristen Bandung, Huria Kristen Batak Protestant, and also the Gereja Kristen Pasundan. In the Buddhism also, in the Hindu also, and also in the local religion as well. So it has become something that the young people especially working on to the religious interpretation, to add more interpretation, more narratives, more theological discourses to make the people in power reconsider their decision. Thank you.
Okay, that's amazing. Thank you so much for sharing. And I think what I heard you say was don't tell the government what to do, and don't tell the religious groups what to do, but include your cultural institutions as you try to make change. And they'll find ways, you know, to think it through, because really, when you think about in particular religious institutions, it's the value of life and all human beings, right? So there are ways to include everybody and work within some strictures that seem to be in opposition. So thank you for your work too. Okay, please. We have a comment from someone online.
Can I say something?
Yes.
Can you hear me? This is Moin.
We can.
Yes. Okay. Can we continue? Can I continue?
Yes, please.
Okay, thank you. This is Moin, working as a country coordinator for vital strategies in Bangladesh. And thank you. I think this is very good, informative session, and we have benefited from it. Thank you all presenters for nice presentation. And what Kate mentioned, Bangladesh identified people as female, male, and third gender. And legal issues on transgender is prevailing here in Bangladesh because of there are some religious and legal barriers for identifying transgender, but I think without proper knowledge, some society and some people are not understanding the issues. And in Bangladesh, also the third gender, I think declaration of third gender is also a big problem here in Bangladesh because of culture of silence. For early age, family do not want to declare any third gender even. So it is included in the rules and regulations. So it can be, people can be identified as third gender also. But in later age, we see some initiative for identification of people as third gender. So declaring third gender is a big issue here in Bangladesh, but transgender is more, declaration of transgender is more difficult here in Bangladesh. But we are hopeful. GHI is working here in Bangladesh for improvement of legal framework and legal improvement of legal reforms. So we are trying to build awareness in the society, and hopefully in coming days with the GHI initiative, we'll be able to make people understand about the importance of registering transgender in the civil registration. Thank you.
Thank you so much, Moin. My colleague Tanya from UNSCAP has some information in response around Bangladesh.
Not specifically around Bangladesh, but around all of the really interesting examples coming from the different countries, which is fascinating. It's quite interesting because I've been working in this space for more than 10 years. And if I look 10, 11 years back, these discussions were never there, right? This was never vocalized. There were, of course, issues at the country level, but it was never something we saw in discussions with civil registers, in discussions with civil society, and so on. And I think it started really only about 5, 6 years ago when we started seeing this topic popping up here and there. And it's really encouraging and wonderful to see that it is becoming an issue that we're discussing much more openly, first of all, and also in forums like this, right? And it's also, of course, fantastic to see the legislative changes in countries. And I really think, I mean, responding to these excellent insights here, I do think that it does need to come from the grassroots and from civil society. It is really nice to see that it is becoming, you know, something we talk about and something we are moving towards in many countries. So thank you so much for organizing this side event as well to put more of a focus on this issue. Thank you.
Thank you. Okay. Please, Kate.
Yeah, I just would love to add to what everyone has been saying from the results of the study that I described earlier. Many people have talked about the importance of including CSOs and grassroots organizations and just sort of lifting up the transgender community and the non-binary community from the ground, and that making change within societies and cultures can have this impact on the government's perspective and then on policy making. And so that was one of the findings from this study as well. So I just like to hear all of the ideas listed here and how people are speaking about it. It's very encouraging. And I think it's nice to feel there is a movement that hopefully we can continue to push forward. So thank you all for participating in this.
Any last words from the panelists before we sort of move to what's coming up for CRVS ID in UNSCAP this coming June?
Thank you so much. Yeah, and, my name is Tanya Sayersen. I'm with SCAP. I'm a statistician here and lead our work on CRVS. And it's really wonderful to be invited to join here with some really fantastic partners. We have been working on civil registration and vital statistics with many partners for a number of years. Back in 2014, all of the countries in Asia and the Pacific, which is a lot of countries, it's basically from Iran and Turkey, all of Asia and most of the Pacific as well. So many, many countries agreed to move towards universal registration, which means that every single birth and every single death and every cause of death should be registered and recorded. And there's been a huge momentum, growing momentum for improving civil registration and vital statistics in this region since then. Part of the things that the countries agreed to back in 2014 was also to assess who are the ones who are not registered, which I think links very well with the discussions we're having here today. They also declared the Asia Pacific CRVS decade, which is coming to an end this year. When we did the review of that, the midterm of that decade, so that was back in 2020, we found that pretty much no countries had done this assessment that they had all promised they would do. So obviously we put extra effort into this area, and over the last few years, we've managed to assist quite a number of countries with doing quantitative assessments of who are left behind, basically using secondary data. But this, of course, does not tell the whole story. And I think what we're hearing from today and a lot of the qualitative work that's happening as well is really part of telling that story in much, much more detail. We will have, formally, we have the end of the decade this year. Most of the countries in this region, unfortunately, have still not achieved universal registration and do still not have fully inclusive systems. So they have recommended that we extend the focus on CRVS until 2030 to align with the SDGs. So we will have another ministerial conference in June, same rooms probably as what you're visiting today, focusing on CRVS in Asia and the Pacific. And I'm really pleased that our countries in the region has basically said we want to focus this ministerial conference on 3 issues. First of all, we are not there yet. We made great progress. We still have challenges. What do we do about that? That's pretty standard, right? we need to do more. Of course we do. But the 2 other topics, I think, fits very well into the discussions we're having today. The first topic, the other one is about inclusivity. So we have been talking a lot about ensuring that everyone is registered, and that is fantastic. We need to move to universal registration, but we also need the systems to be a little bit more flexible, right? And I think this links very well with our discussions today. We need to make them, we need to create fewer barriers for registration for everyone, right? And the groups we've been focusing on today is very important, but there's also a lot of other groups who feel excluded from the mainstream systems. And I'm looking at Subin, who I know is representing certain other groups as well. So the focus, so that our countries have agreed to put this focus on inclusivity is actually quite huge. And it does give us a little bit of a space to start discussing these issues at the policy level as well. I was also really pleased to see the very big focus on the civil society, because that is something I think when we are talking civil registration and vital statistics, for many years, we kind of forgot a little bit about civil society. And that was a huge problem, right? Because the people who are impacted by these systems and the lack of universality and so on are real people on the ground, right? And we need to hear the voices of those people in order to push our policymakers to be more inclusive. So in preparations for the ministerial conference in June next year, we are working on quite a bit of engagement with civil society. We have kind of 2 streams. One is working with children and youth, and the other one are working with the rest of civil society. And the focus on the work on the civil society is actually led by our colleagues from GHAI, which is fantastic. So this involves some consultations at the country levels. Unfortunately, not in all of our ISCAP countries, but in a number of countries. And then we will have a forum for children, youth, and civil society in March here in Bangkok. Also, these rooms up here. So we will have a forum on the 4th to 6th of March, where we're really hoping that all of these voices, both from these groups that we've heard from today, but also for the other groups that feel left out on purpose or not on purpose from these government systems. So the hope is that we will get a very broad variety of civil society engaged in that forum, so that we can really ensure that those voices are brought to the Ministerial Conference and included in the agreements that the countries make going forward. So that, you know, when we're sitting here again in 10 years, we've moved a lot further. We have moved a long way for the last 10 years, but there's still a really long way to go. So if you want to hear more about this, our CRVS work in general, and also the work of our CRVS partners, we have this getinthepicture.org website where all of our partners and our activities are generally in there. So I hope I'll get to hear more from most of you. Thank you.
Thank you so much. So let's see. Any questions or other comments? Please.
Microphone?
Oh, sorry.
Almost on it.
Thank you.
Strategic spot to sit in on.
Yes. Thank you. Just wanted to congratulate the folks from India for the marvelous work that they've done, and just envy your achievements. My name is Manasseh. I'm from the Tonga Ladies Association in Tonga, based in the Pacific. Just going through one of the major challenges that we've faced in Tonga is that the legal restrictions that focusing on female and male, and I put research there because some of the international organizations or academic that comes to Tonga and to surveys in Tonga, and they sometimes invite CSO like us when we come to the platform, and then when it comes to the specific statistic on sex and gender, and then whenever our officials from statistics department is in the room, there's going to be an argument with us. When we say you have to be gender diverse includes, and then on the other hand, the statistics department is arguing on the legal sides of it. So it's very hard for us. So our argument with them is that how can you capture the needs of the population if you can't include gender diverse in that survey? So there's quite a few surveys that comes up, and it ended up with being restricted to the legal recognition in Tonga. So my question to the panel is that what effective approaches have you used in trying to, we've collected some data just within our organizations on gender diverse, but it doesn't recognize at the national level, but we need to be recognized at the national level so that it's easy for us to make plans and lobby for it at a national level. Thank you.
This is a thoughtful one. Like it raises multiple questions on sensitivities mainly, and till date we have been advocating that in countries where there is nothing, might be a public interest litigation is the first step. So that brings all the parties to the table, and if in the country or the civil society organizations can take a lead for a discussion on a judiciary side, then it will make more sense rather than when the appeals from your side have, like, to some extent have not been agreed on due to procedural inabilities or due to like judicial inabilities, in that case, litigations work well. So that can be one of the instruments for calling out all the parties to the court of law. And then a decree which works or which does not work, at least we have a conclusion that yes, for this, these are the laws that we can take on, and then it can be, then the role of like civil society comes to the fore, in which the activism, the demand. So that's where like civil society fit in an exact position. But at least we need to discuss it in an unbiased way. And the best table for discussion I would recommend is the judiciary. And as my friend from Nepal also like suggested, like the Supreme Court ruling. So those type of rulings are usually very helpful. And in all the countries that we are working, it has been through the judiciary side. So I hope like I'm able to answer your questions and in a countries with sensitivities. Thank you.
Okay, and I would add to that. So I am like, I hear litigation and I hear arguments and I hear oppositional, and that I think that there's ways that we can work collaboratively and to try to find a seat at the table. And to the gentleman's point from Indonesia earlier is like, how can we have respectful conversations as well to say, not you must do this. And here's why, here's the law, right? But instead, here's why it's so important to do this. I mean, think about Noor's story is like, she couldn't go to college because there were women's and men's college and they were separate and they wouldn't enroll her. So getting a seat at the table, telling these stories, personal stories, getting some media attention, and really just keep, be persistent, right? Keep working towards it so that people, I think when people understand the reasons and the realities of people's lives, that they are more able to make the adjustments that need to happen on that national level. So and I'm not against litigation. I think it's actually, sometimes you do have to get there, but you also have to have that seat at the table first, right? To be able to sort of lay down the papers. Yeah, my pleasure. Well, with that, I think we can say this is a wrap. We are all here for the ministerial conference for the next few days if you'd like to further discussions. And you can find us through the Data for Health initiative, where all partners along with UNSCAP as well. And thank you so much for coming. Really appreciate the comments and insightful thoughtfulness.